Christine Caulfield here for Mental Health Monday, and today we're going to be talking about self-harm in children. So, in a very important topic, and of course, LSF Health Systems always helping us with ways that we can help our friends and family. So, thank you for joining us.
Oh, my pleasure.
Always great to see you. So, give us a general picture. I mean, I think we hear this term sometimes, but we don't necessarily know, like, is it just one thing or can it be multiple things? So, can you just at least kind of tell us what it is and how common it is?
Sure. Actually, there are several ways that we find that our kids are self-harming. And by the way, it's not suicidal.
Okay.
It's non-suicidal. They may burn themselves, scratch themselves, cut themselves, or hit themselves. And what we're finding is there is a 30% increase in ER visits from 5 years ago.
Wow.
With this kind of behavior. And so we really want to be mindful and intervene early when we know that our kids are engaging in self-harm activities.
Right. So what are some things then parents or guardians should be looking out for?
Well, a lot of times our kids will try to hide what they're doing. They'll wear long sleeve shirts, for example, so that you can't see this cutting, the scars. Right. They might not want to undress in front of anyone. They might not want to go swimming and wear a bathing suit. They may isolate. You might see drops in grades or withdrawing behaviors. Just notice what's going on with your child, and if your gut is telling you that something is wrong, trust it.
It probably is, right?
Yes, indeed.
So then tell us some of the red flags. What are some things that I guess you have heard about or even maybe have dealt with in your practice?
Yes. So a lot of times our kids, you know, they have so much pressure now than ever before. We've got the bullying through the social media. There's pressures with testing and so on. And so our kids oftentimes don't have those healthy coping skills.
Right.
Why kids self-harm, and I'm often asked that question, is because when our bodies are damaged or undergo trauma, like cutting, like burning, our brain releases feel-good chemicals, believe it or not.
Interesting.
That calm the system down.
Oh.
And so our kids are not doing it for attention or because they're suicidal. They're doing it because they feel relief after they engage in that self-harming behavior.
Wow.
So we want to understand that our kids are under a lot of pressure.
Right.
If you're noticing some of the things like change in appetite, either eating too much or not enough. Sleep patterns are being interrupted. They're not sleeping or they're sleeping too much. Drop in grades, change in friends, isolation. We want to really pay attention to that and intervene early.
Yeah, and I know that you said that a lot of times it's done in secret. They don't want the parents to know or the guardian to know.
Precisely.
And I think also they probably think I'll get in trouble if they find out.
Yes.
So what should a parent or a guardian do if they suspect that this is happening in their home?
Yes, well, you want to be very accepting, create a safe space for conversation. You don't want to be punishing. You don't want to say, why are you doing this, with anger.
Yeah.
Some of the ways to approach this would be, you know, I'm really concerned about you. I've noticed some things that concern me, and I want to know what's going on with you. Encourage them to talk about what's going on without judgment, and then recognize that this behavior needs clinical intervention. And so, again, creating the safe space. We're going to get help. We're going to work on this together.
Yes.
I love you no matter what.
Yeah.
And let's get some help so that we can learn and grow and make things
thrive.
better for you.
Yeah. So how can they get in touch?
Yes, indeed. So we have one of our programs at LSF Health Systems is through one of our provider organizations, Say's Kids, and they have a program called Coaches.
Okay.
And you can contact us to find out more information about this. They deal with this all the time. And call us at our Access to Care line number, which is manned 24/7
Okay,
by our
wonderful.
clinical team, 1-877-229-9098, and we will connect you to those community resources that can help.
Very important stuff. Thank you so
Yes.
much, Doctor, for joining us again this week.
My pleasure.
Of course, and we'll be right back.